Welcome to Fostering Solutions, a podcast that uplifts people and enterprises making positive impact in communities around the world. I'm your host, Dr. Michelle Foster. Our guest today is Sharon Lansdale, who is with the
Center for Rural Health Development.
You're located in Putnam County?
We are.
Awesome. So tell the audience about yourself, Sharon. Who is Sharon Lansdale?
Well, I've been fortunate to have led the center since 1994. So I've been there since the beginning, since it was privatized. It was part of state government prior, and then they decided they needed a private partner, and I was the first private CEO there. Mm-hmm. I'm also Oma to 5 grandkids.
Oma, I haven't heard that term.
Oma, it's German.
Okay,
My husband is first generation German on his mom's side, second on his dad's side.
Nice. Okay.
Yeah, so we're Oma and Opa, and never really expected my daughters to move back home, but they did because when they started to have children. And so I have 5 grandkids, 9 to 3, and I'm the wife to Stephen, who is absolutely my soulmate, and I'm soon to be retired.
You are retired. I didn't realize that.
Yeah,
okay.
I've announced it, and my replacements have already been designated by the board. We haven't announced anything yet.
Okay, nice.
Yeah. So I got about one more month.
Oh, wow.
Yeah,
okay.
Very soon.
Okay. Do you know what you're going to do next, or you're just being Oma?
Well, yeah. The reason I'm retiring is to be grandma.
Yeah.
I really want, they're 9 to 3. When they get to be teenagers, they don't really want me around, and I just want to be part of their lives. My daughters want me to be part of their lives. Even my son-in-laws want me to be part of their lives. So I'm really retiring to be with family and kids. But I'm going to stay associated with the center for about 4 more years as a part-time employee.
Okay.
Had no desire to start a consulting practice or anything like that.
As long as you retire and start consulting.
I want to retire.
You want to retire for real.
Yeah. So, but I do need to maintain affiliation for about 4 years because of some other things.
Okay.
Yeah.
Good. So you are the president and CEO.
Mm-hmm.
Describe your journey to the current position that you have there.
It's called being curious.
Okay.
I'm a pharmacist. Was very, very happy being a pharmacist. I love pharmacy.
Okay.
But I was in the hospital, and I was educating patients with diabetes about how to manage their diabetes. And I became curious as to what was out there in the community for them, because I was a hospital-based pharmacist.
Okay.
So I went to the state health department, and I asked them what is out there for patients with diabetes to support them. Because, as you know, it's a very manageable chronic disease, but it has to be managed, at home. And basically the health department said nothing.
Wow.
There was nothing there. So I went back, and everything. And several months later, I got a call from the health department, and 2 legislators had put money in the budget to start the West Virginia Diabetes Control Program. And they said, "You're the only person that's ever talked to us about this.
Wow.
Would you be interested in doing this for us?" And being the curious person I was, I said, "Sure, I'll do it." Mm-hmm. So I went to the state health department. I was just on contract. And I started the West Virginia Diabetes Control Program and fell in love with public health. And while I was on contract, they asked me to start a couple of other new programs for them, the biggest of which was a federal contract with for tobacco control.
Okay.
So I did that, and then they lost their director, actually hired someone else. then that person didn't show up, and they called me and said, "Would you like to be our director?"
Oh, wow.
Yeah. So I said,
You must have been doing something great if they keep making you all these offers.
yeah. Well, I guess they liked me. But so I said, sure, I'll try that, And so I was there for, all told, contract and on staff for about 10 years. And then my girls hit middle school. And I was traveling so much with my job, and they just needed mom at home. Teenage girls in middle school, what can I say? So I left, and I went back into pharmacy. I was director of pharmacy at a hospital. The hospital was getting ready to change hands, and I wasn't too sure about the new owners. I heard things, and, I was just like, I'm not sure about this.
And this is West Virginia.
West Virginia.
Okay.
And so someone approached me and said, we want to start this organization called the Center for Rural Health Development. And we think you have the skills to lead it if you're interested. So I interviewed, got offered the job, went to the hospital administrator at the hospital because I really had a lot of respect for him, and basically said, I have this job offer, but if you're going to stay, I'll stay. Because the hospital was transitioning. And he looked at me and he goes, tell me about your new job offer. So I took the center's job, and that was in 1994, and I've been here ever since.
Awesome. So what keeps you, and you're a community development and health community development financial institution, right?
We're a CDFI.
Right.
The center is.
The center is, yes. So what keeps you doing the work that you're doing?
I love the mission of our organization. I believe in it. I feel like
share, what is that mission? What is it?
It's twofold. One is to strengthen the rural health infrastructure in West Virginia, and the other is to improve the health of West Virginians.
It's a lot.
Well, it's It's really two different sides of it, and there's the strategies. Most Americans equate health with health care. Very different strategies to improve health.
Some of it sounds more like policy too.
Yes, it could be. Yeah, there's policy. Yeah, but I just believed in the mission, and I've been fortunate. Work with a great team, and so I just had no desire to leave the nonprofit sector.
Awesome. So this series is about maximizing impact. What does that mean to you, what does that mean to you in your role there at the Center for Rural Health Development?
It really does mean achieving measurable and impact and meaningful results. So many people in the nonprofit sector think if we have a meeting, we have a great conference, that we've achieved something. And that's just how we get there. So really, if we're able to, I've always been a person that we want to achieve outcomes. And I want to be able to communicate what those outcomes are that we've been able to achieve. So that's what, to me.
And that's what the pharmacist in you, I'm sure.
Oh, yes. The pharmacist.
So what change are we really, seeing with all these great things that are...
Yeah. Well, I'll give you our loan fund. Our loan fund is on the healthcare delivery side of our mission. And we identified that there was just that rural healthcare providers weren't necessarily able to access financial resources from banks and things like that. We knew healthcare. And so when we saw that, and we had an opportunity, the Robert Wood Johnson Foundation, we were part of the Southern Rural Access Program that was funded by Robert Wood Johnson and the Benham Foundation. So we went to the governor and to the legislature and said, here's what we found. Rural health care providers don't necessarily have access to capital financing. At that time, we have a lot of federally qualified health centers in our state. We're fortunate in that respect, but they weren't bankable. Banks didn't understand them. And so we said, here's what we want to do. We want to create this loan fund. At that time, it wasn't a CDFI, it was a loan fund. And we want to make capital financing available. Well, the governor and the Senate agreed with us. The House didn't agree with us. So we asked for $1 million, we got $500,000. We put the private funding with us, so we started with a $2.5 million loan pool. We went out and made our loans. I think we made maybe 6 or 7 that time. We went back, we prepared a report on the results, took it back over to the House side and said, here's what we did. And there's more need out there. This time the House got on board. And so all told, over years of asking for the funds, telling them what we would do with the funds, showing them what we did with the funds. It was exactly what we told them we'd do. We got $2.5 million of legislatively appropriated funds. Now the loan fund is an $11 million fund. Wow. And we've made, we've made about $33 million in loans. And by leveraging this with private, we don't compete with banks. But so we leverage banking capital, spread the risk with them. And to date, we've made about $73 million in healthcare loans.
It's impressive,
Yeah, less than a 1% default rate. And that's important. When a rural healthcare provider goes out in a community, they're no longer in business, that leaves a hole in access to some sort of healthcare services. Absolutely. And it's not easily made up. So it was important that we have a low default rate, and we work hard at that.
That's wonderful. So I wrote this book, Maximizing Impact, Success Strategies for Dynamic Nonprofits. What chapters in the book resonated with you and why?
I read most of it, not all of it word for word.
That's okay.
But I did read a lot of it. And I would say the chapter on getting the right people on the train resonated the most. We're a small nonprofit. There's like 6 of us there. And that's big because we have been 4 forever. And we almost had a disaster when we had the wrong person on the train.
Oh, wow.
And how easily one person in a small organization can take out an entire organization.
Wow.
She had allies, but, it could have done it. And I had to go to the board and basically say, here's the issue, here's the problems, here's what I've done, here are the mistakes I've made along the way in trying to address this, and here's what needs to happen to fix it. And I left the room. They discussed, came back in the room. They said, we'll support you, because it was pretty drastic what had to happen. And they did, and we've not looked back since.
That's
so,
awesome. Getting the right team is just so important, because you can't do it alone as the leader.
No.
You cannot do it alone as the leader. So really having that team there to support you and to, be your eyes and ears and to really help to get the work done is so important, isn't it?
Absolutely. You need everybody rowing in the same direction. And that's what was not happening at that point in time. But now everybody's rowing in the same direction. We have differences of opinion, we have discussions, but we're a team and we work through them, we discuss them, we put everything on the table, including with our board. And I have to say that not only is our staff strong, but our board is strong.
It's wonderful.
Which is great given the transition that's about to occur.
Change is always difficult, isn't it?
But the other thing in that chapter I really appreciated was the comments you made about diversity, equity, and inclusion. And you are absolutely correct. You cannot have diversity without inclusion.
That's right.
If it's not a place where debate is welcome. Mm-hmm. Contrary opinions are welcome and debated. Mm-hmm. It's no use to have diversity.
Right, everyone can't be thinking the same. You've got to have different ideas, different because we're all from different vantage points, right? We bring something different to the table.
Yeah, and and it's important. You're also correct in that chapter in saying that strong organizations have diversity and inclusion. Mm-hmm. And if you have those two, you will have equity in your programming.
That's right.
So that really resonated with me because I absolutely believe that.
Mm-hmm. Mm-hmm. So you mentioned, seems like your loan program has been very impactful and very efficiently and effectively ran. So what strategies have you used to really maximize the impact of the loan program or whichever program you think is most impactful?
Well, I mean, I think all of our programs are impactful, but the loan program is probably the most visible because it's the largest. Yeah. And, I gave you the numbers and everything like that. And the numbers were possible from the technical assistance we provide. Mm-hmm. Mm-hmm. We work with potential borrowers before a loan. How long before? I mean, is it? Oh, it depends.
It depends.
Yeah, it depends. I mean, some borrowers we work with, and tell them what's needed, tell them what's in front of them, especially startups. Startups are the most challenging. I mean, we can work with a startup for a year, and we can work with some startups for 3 months. It just depends.
Yeah.
Mm-hmm. And we refer them to other programs that can provide the technical assistance that we don't have the capacity to provide. So we do that, and then the technical assistance afterward, because things happen.
Right.
People get deployed to war. Spouses get desperately ill.
Divorces happen.
Happen.
Life happens.
Life happens. And so, but it's not just the numbers, it's the stories. I mean, we have one of our loan recipients is an ophthalmologist in a rural community. And literally, he was at his wit's end. He could not get bank financing anywhere. So he came to us, and we looked at his financials, and we looked at him, and we made the loan. And he said that I don't know that he would have had to close his practice or significantly reduce it, but we're talking a very rural community. One of our best success stories is a dentist who came to West Virginia and located in the New River Gorge area because his wife was from that area.
Okay.
And he was a whitewater raft guide in college and everything. Nice. So when he approached us, his practice was in a double-wide trailer. So we helped him build his new building and financed it for him with a bank. And then he brought on an associate. And years after that associate was there, we helped the associate buy into the practice. Wow. And most recently, maybe a year or two ago, we helped that associate buy out the practice.
Nice.
So that was succession
planning.
Been
with them, yes, for a while. That's
awesome. Our loan fund started in 2001, and they were one of our early loan recipients.
Wonderful, wonderful. So, in this great work that you're doing, what do you know now that you wish you knew when you first joined the organization?
What do I know? I don't know if I'm glad about this, but I was pretty naive. And
sometimes that's not a bad thing. You know?
I think it wasn't, because had I known all the things that were going to happen, I might not have taken the job. Yeah, it has been really and truly a blessing to be part of the center. But it hasn't been without its ups and downs. It hasn't been without, conflicts, conflicts between organizations, those type of things as well. When you're the new kid on the block, everybody thinks you're taking a piece of their pie. So there's those kind of conflicts as well. Pretty significant ones. But so had I known that, I might have just stayed in pharmacy and been happy, maybe with another hospital, but I would have probably been better. I love pharmacy. I just fell in love with public health.
That's good. What are you most proud of? And I, if you need to repeat some of this, I already, heard from you, just being able to help providers who, the bank wouldn't give a chance. So what aspects of your work are you most proud of?
Probably the team we've built.
The team. Mm-hmm.
They are, it doesn't mean staff, loan committees, board, it changes, and it changes over time. But with very few exceptions, we've had a tremendous group around us.
That's great.
So that's probably what I'm most proud of. The other thing, is we've stuck to our mission. We've had opportunities, and once in a while I'll take it if it's not too much, but that would pull us away from our mission. And I've sort of resisted that.
Yeah, mission creep is just a real thing, isn't it?
It is a real thing, and it can take you under.
If
you chase dollars rather than coming up with your mission and what programs. But the other part of that is I never envisioned that a loan fund would be part of our mission, would be part of a program that would help serve our mission. But when the opportunity presented itself, I was like, okay, let's talk about this, and see, and it is part of the infrastructure that was needed. These rural providers needed financing.
Yes.
So
a real need, a real challenge.
So we learned how to be a loan fund, even though I'm healthcare and, but we knew who to call on to help us.
Right. So are you the only healthcare CDFI in West Virginia?
We are a healthcare only CDFI.
Healthcare only. So other CDFIs.
There's other CDFIs.
They fund in various areas. Not just healthcare.
Yeah, not just healthcare.
Okay.
Yeah, they fund other areas.
Gotcha.
There's only 3 CDFIs in West Virginia that serve West Virginia. And I think, and I may be wrong, I haven't looked at this recently, but I think there's only 2 healthcare only CDFIs in the United States.
Oh.
Yeah.
That's even more special.
Yeah.
Okay. Interesting. Are there any plans to grow your area of service? Are you sticking with health, and maybe are there any growth opportunities that you're looking at as an organization?
Yeah. We recently, just prior to COVID, started a new program on the health side. It's called Wild, Wonderful, and Healthy West Virginia.
Oh, yeah. I've heard of that program.
Yeah. You've heard that a little bit. Yeah. You've helped fund part of that with us. And that is a long-term endeavor. And, the advantage... Another advantage I did not envision, I guess I just wasn't thinking a whole lot, but with our loan fund, we have earned revenue. And our board, when we started Wild, Wonderful, and Healthy West Virginia, which is to, we call it disruptive innovation. We want to improve the health of West Virginians. And as you've heard me say, since 1990, according to America's Health Rankings, West Virginia's been among the 10 most unhealthy states in the nation. And we didn't get there overnight. COVID didn't put us there. We've been that way. We go up and down for, since 1990. So when we went to the board, we said, we know what to do. And my public health background and the public health background of Elaine in our office, we knew exactly what to do. But we needed to develop a model that could be used in rural Appalachian communities. Not something for Charleston, because Charleston can do anything. So it had to be simple enough for them. And we started it. And when we did, I remember the board chair at that time looked over at me and said, so Sharon, when we see the results of this, you won't be here, right? And I always tease him now and say, I thought you meant retirement, and you might have meant here. And both are true. And both are true.
That's a long-term investment.
Well,
time and effort.
We have communities.
Resources.
There was a report last week or the week before. 11 counties in West Virginia have suffered from generational poverty.
Mm-hmm.
And like I said, this generational poverty didn't start yesterday.
It did not. Yeah.
And it's going to take a while to make the changes in the community to support all individuals,
Mm-hmm.
and address all the conditions in communities so everybody can thrive, no exceptions.
Absolutely. So for someone who may be out there listening and thinking that they may be interested in getting to where you are as a CEO of a healthcare CDFI, what advice would you have for them?
Well, and I always say this, not every good idea needs a nonprofit around it.
Mm-hmm. Mm-hmm.
Many nonprofits fail. A nonprofit is difficult.
It's hard work.
It's
not a cakewalk.
It is not. I don't think people realize how difficult a nonprofit is.
Mm-hmm.
So my first piece of advice would be find a partner that you could work with. Find someone that whose mission your program would fit in,
mm-hmm.
and see if that partnership would work. And if it does, try it out for a year, 2
mm-hmm.
years.
Mm-hmm.
Grow your program. Use it. Sort of like what you did with Ferguson
mm-hmm.
Memorial
mm-hmm.
Baptist Church. Grow it out,
Yeah.
see if it works, and then form your nonprofit if you think you can be sustainable.
Mm-hmm. Mm-hmm.
And if not, work with that partner organization. So that would be my first piece of advice. Start slowly.
Absolutely. So as you look to the future, of now, retiring and being, is it T-Ma or G-Ma? What did you say?
Oma.
Just totally off. Oma. Retired to being Oma. As you look to the future, what gives you hope?
I have hope in young emerging leaders.
Mm-hmm.
I think for the most part, they will learn from our mistakes.
Mm-hmm.
I think they're open, and I think they want to make a difference in West Virginia.
Mm-hmm.
And so I have hope in that. And then I also have hope for my family that we're raising,
Mm-hmm.
the grandkids, my children. As you say in your book, you're a Christian. We're a Christian family.
Mm-hmm.
And I always tell people, I didn't come up with this idea. I feel like my life has been directed by God.
Amen.
I pray all the time for different solutions to different things. And sometimes a door will close that I really wanted not to close. But then I found, a month, 2 months, 3 months, I'm like, what doors that opened up?
Something even better, right?
Yeah.
Yes.
And I just go, wow. And I remember many a time sitting in Rob's office and saying, I know, I just need to tell you this. And it's true.
I totally get that.
Yeah.
Totally get that.
Yeah.
You may have your own agenda and own plan, and it doesn't work out, but then something even better comes around the corner.
And you just got to have faith.
You really do.
You put your head down, you do your work,
Mm-hmm, mm-hmm.
and then everything else.
It works out
It
somehow. And that's a big part of what this nonprofit, and I call it a ministry because that's really where, to me, that's where it started, and really, what transformed my life and to get me to where I am today. So, yes.
Well, that's the interesting part of your book, actually.
Mm-hmm.
Being in nonprofits as well, that's what I meant. I didn't read every word, so I probably just skimmed the how to do strategic planning.
Right, because some of it you know.
Yeah.
You already know. You've been at this a while. Yeah.
But what was interesting about the book was your personal story.
Mm-hmm.
And it was amazing. And so after reading it, I actually told Robin and Elaine, I said, you all need to read this before you assume positions at the center.
Okay.
You really do. And I'm
good.
very sincere about that. It was very, very good. Because at first when I looked at it, I thought, Is this going to be a how-to? Yeah. Is this going to be a how-to? And then when you asked me to do the podcast, I was like, okay, I better read it. And then I started reading it, and it was good. I mean, it was very, very well done.
Thank you so much. And thanks for being my guest today.
You are welcome.
On your first podcast.
Ever.
So, ever in your whole life.
Yeah.
All righty, Sharon. Thank you so much.
Thank you.
Are you thinking about starting a new nonprofit organization? Are you with an organization now and would like to take it to the next level? Are you on a board or committee of a nonprofit and want to make sure that you're being effective? Then I have the answer for you. My new book, Maximizing Impact: Success Strategies for Dynamic Nonprofits. I wrote this book to share my journey and the secrets of my success. Learn the essentials of designing and implementing a program, finding money for that program, evaluating that program to make sure that you're making an impact, and so much more. Maximizing Impact: Success Strategies for Dynamic Nonprofits by me, Dr. Michelle Foster. Be inspired, be informed, and access invaluable resources. Get your copy today.